Hi gang, Sandy here. So today I wanted to talk with you about shin splints. And really this is a common injury or an issue that Highland dancers often experience. And I'm going to talk about why in just a few seconds. So first of all, we hear the term shin splints, and yes, we all know that they can be very, very painful. Basically, a shin splint term means that you're experiencing lots of pain across the tibia, which is your shin bone, okay, around it, maybe a little bit behind it. And it's just a catch-all phrase for the pain that you're experiencing there. The cause of it can vary from dancer to dancer. It could be that you just got inflammation back there. It could be a result of stress fractures. It could be a compartmental kind of syndrome. Only your doctor would be able to tell you a little bit further about what type of shin pain you're experiencing specifically, okay? So number one is if you start to experience shin pain and it becomes a little bit more of a common thing that you're not able to get rid of, absolutely see your doctor for follow-up on what to do, okay? Now, why do we tend to get shin splints? Well, here's the problem. Shin splints are caused by a couple of different things, and Highland dancers do a lot of them, unfortunately. One is that we often dance on a really hard dance floor. So you want to make sure that the dance floor you're regularly practicing on is not having a subflooring that's based with concrete or something super hard. Ideally, you have a dance floor that's meant for dancing on. Maybe a splintered floor or a floating floor that is meant to have people do high impact movements on them safely over time. Okay, so hard flooring can really do that. Also, number two, landing on the ball of your foot repeatedly. Another repeated action, especially on a harder surface, that's going to result in inflammation in the muscles around that shin bone, which can result in that pain, the shin splints. Okay, so having that problem where we're always on the ball of your foot, that leads to those shin splints issues. Now, what else can result in this? Increasing your training too frequently. So if you're increasing either the volume or the amount of your training too fast, then you might develop shin splints. The other thing is if you increase the intensity of your training and you don't back off on how much of it you're doing, again, you could start to notice that you're developing some shin splint problems because of increasing either the amount or the intensity of your training too quickly. So gradual increases over several months is the best course of action to help hold off any kind of injury that can come on from overuse, okay? Another common issue that we have is that ankle mobility, okay? Now, if you've got limited ankle mobility, meaning mostly front to back, kind of this way, that's going to create tighter calf muscles, which in turn can result on excessive pulling on that shin bone, which is again pain in the shin or shin splints. And then finally, if you've got lots of ankle range of motion inward and outward, meaning pronation where the ankles fall in or supination where the ankles tend to go out, again, that puts an unnecessary imbalance in the calf muscles. So one side of the calf is used a little bit more and the other one's a little tighter, in which case it pulls unevenly on the calf muscles and again can result in your shin splint problem. Okay, so those are just a few of the things that are very common that can result in shin splints. All right, now, knowing that, what's the treatment if you start to have shin splints? Number one, see your doctor. Okay, he or she will be able to determine exactly what kind of pain you're having and what the result is of it. So they might give you anti-inflammatories or they might just prescribe for you something like rice or rest, ice, compression, like those compression sleeves to help reduce inflammation, and elevation of the legs above your heart for a few minutes a day to help release that blood flow to the area so the inflammation is a little bit less, okay? So again, see your doctor and they can help you determine the right course of action specifically for your case, all right? But be aware that shin splints can take several months to get over depending upon how severe they are. So it is extremely important that you take the time to recover and come back slowly into your dancing if you've experienced some severe shin splints, because you don't want to end up getting back into it and then having all of a sudden the shin splints come back with a vengeance and then you really regret not having taken the time to slowly work your way back. Now, what are some exercises that you can do to help kind of avoid the risk of developing shin splints? You have a couple things, and you may already do them, okay? One is, of course, to make sure that you're getting adequate stretching throughout the calf so that you're not developing excess tightness in your Achilles or in the calf muscles. Now, you have two calf muscles. You have your gastrocnemius, the higher, bigger, fatter one that we all are aware of, and down a little lower, down towards the heel, you get your soleus. Okay, both are important to stretch. Most of us already do this stretch, but if not, here's a couple reminders. You're going to take one leg, press it back, and you want to make sure that both sets of feet are pointed straight forward. So the back toes should not be turned out. They should be straight forward. And press that back heel firmly against the floor, and imagine trying to push the wall away from you as you press that back heel into the floor. Just hold your stretch here for about 20 to 30 seconds with a fairly straight leg, and breathe, okay? Now this type of stretch, this type of static stretch, you would want to do after you've already been moving around. You would not just start with a stretch in the morning or right before dance class practice. Do some movements, warm up the body, and then you can do some static stretching first. After this stretch, which tends to get the higher up around the gastrocnemius, the higher calf, you're going to bring that foot in about halfway, bend the back knee, and kind of sit back down, still keeping that back heel flat to the floor, and the toes both facing front on both feet. This is going to take your stretch down deeper, down a little lower into your soleus muscle, okay? Same thing, hold for about 20 to 30 seconds, all right? After you do that, you would switch to the other side, same thing. And then I want you to try this stretch again, but instead of having both feet facing straight forward, I'm going to encourage you to take that back foot and you're going to turn the toes in just like a couple centimeters, okay? Just turn it down a little bit so you have slightly inverted toe position, and you're going to feel this change in that stretch on the calf, all right? And same thing here. So we went from this kind of parallel position to a slightly turned in one. And you'll notice that you change that position on the calf. Okay, and then you repeat on the other side. So those are one kind of big stretch thing that you would want to make sure that you're doing on a regular basis. Now, as far as strengthening, you want to make sure that you're strengthening, of course, not only your calf, but the opposite muscle group. This muscle here, your anterior tibialis, it helps to pull your toes up. This is one that is sorely underused, especially in Highland dancing. We're so often here, we're never here. Very rarely, okay? And not enough to counteract what we do on our toes. So for this next exercise, I want you to have a parallel stance. It might help if you're near the wall, just for a little balance. And all you're going to do is your calf raise, shift your weight over to one side, and slowly lower down your heel. Come back, both feet on the floor, weight even, raise up, and slowly lower the heel down. Lift up, and lower down. Lift up, and lower down. And I know this sort of seems kind of simple, but this helps develop the strength in the ankle, and most importantly, you should be able to look at yourself in the mirror and make sure that as you're lifting and lowering, that the alignment of your knees and the position of your toes and your ankles is all in line with each other, so that you don't have either the rolling in, the rolling out, that kind of thing. You want to make sure you're straight up. As you shift your weight, you keep that same straight position and lower gently back down. So you want to repeat 10 of those. And then, moving on into the opposite, you would want to do some toe taps. Same thing. I want you to lift up one toe and lower down slowly. And then switch. Lift up and lower down slowly. Lift up and lower down slowly. Lift up and lower down slowly. So with these, it's really important that you don't hyperextend the knee. I want you to just have a nice relaxed knee, but pull up, feeling it in the front of the shin, doing the work, and then slowly releasing down. Versus jamming the leg back, and that's not really actually going to help. So keeping your posture pretty erect. The work comes from the front of the shin, right along that tibialis anterior muscle, okay? So those are just a couple exercises that you can do when you're watching TV. If you're just kind of sitting in a doctor's office, you're waiting impatiently, right? So you can actually be sitting down doing those toe tap kind of movements to help strengthen the front of your shins, all right? So we've talked about what shin splints are, why they happen, what are some treatments, and then some exercises to take care of them if you're not currently experiencing shin splints, okay? If you have any questions, let me know. Good luck with these. I hope they help.